I would love for you to meet Kelly.
Hi, my name's Kelly Kitley, and I'm a Chicago native with 4 children. My husband and I have been married for just about 17 years, and I'm a psychotherapist and author. My journey as a therapist and mother has truly evolved. Having suffered from various traumas in my childhood and throughout my life, I turned to alcohol as a coping mechanism and really found myself engaging in mommy drinking culture. And looking at my children, I knew I needed to do something and change. I have been sober 8.5 years, and it is paralleled with my journey as a therapist. I mostly serve parents who have had alcohol interrupt their lives. It has been so fulfilling, and I love that I can help others, but it has truly been quite draining. Mostly during this pandemic, we have all needed more support than usual, and it has left me less time to do things for myself, and I've been feeling a little burnt out.
It is important to look at a whole health perspective when we're looking at alcohol consumption. And I don't want to get too specific about how many drinks, because as one of the other guests mentioned before, alcohol affects us all differently. Yeah. And so the CDC says that 1 drink a day is moderate drinking. And we also know that there are 5 glasses of wine in a bottle. And so the question we need to be asking ourselves is, how do I feel when I drink?
I think that is oftentimes why people are hesitant. Yeah. What am I going to do? Mm-hmm. You know, that we rely so much on alcohol in social situations. Mm-hmm. And especially now where people are feeling bored, we're noticing people are drinking more and they're at home with small kids, and being able to recognize, not that drinking is bad, but, you know, I think oftentimes people sign up for dry January because they've imbibed so much over the holidays. And so they're wanting to give themselves a detox. Sure. And so what I tell my clients is, try it out. Just observe. How much are you drinking? What are you drinking? How do you feel before you drink? How do you feel after? And you're really just doing an assessment of how alcohol plays a role in your life. Thank you so much, Ginger, for carving out the time to be able to talk to me about your own mental health. You are such an advocate, and I've been watching from afar as you've shared your struggles, and I read your book, and you are such a role model to so many women and people in general. And I want to thank you for that. And I want to thank you for continuing to break the silence and the stigma of mental health. And I just want to jump right in. I have been so admirable of the work that you've done in sharing your story. I'm wondering if there's anybody who advised you not to be so open about your journey in mental health.
I'd say the toughest critic, or the one that slowed me down the most, was myself. And then my therapist, I would say. He wanted to make sure that when I started talking about it, I was truly ready, because there's a fine balance of being ready and being prepared for the negative part that comes with being so open and transparent. It's small, but I didn't have the training from television. Honestly, I don't know if it would have been a good idea for me to do.
They are feeling increased anxiety around just how to be and communicate with people and build friendships and being able to feel comfortable in their environment.
Have you seen children hit crisis points?
Low self-esteem and low confidence and feeling depressed, and as a coping mechanism, turning to eating disorder behavior or cutting behavior, and really not being able to manage the intensity of being back in a school environment.
Being able to distance yourself and put boundaries in place, because people are triggering other people all day long and projecting a lot of their own insecurities.
Therapy, Kelly, can really help.
Either individual therapy, couples therapy, group therapy. There's so many options out there. And I love telling people we're not responsible for our first thought. It's the preceding thoughts that we're responsible for.
Why are people obsessed?
Oh my goodness, because it's escapism. It is tapping out of reality. And I think especially today, it's so important to unplug and recharge. Connection in and of itself is so good for our brain chemistry. And so when we're doing something that we feel like we can move and sing, it just really heightens the experience of connection with somebody.